everybody. This is Laurie Lockney with Longtree and Associates. Um, we have been working on some of these strategies for mental health, mental wellness for elderly. And as we've been doing the research and talking to many of you in the field, it's very important to understand that we may have the best medical, clinical care in the world. But if we don't start with the basics of our mental health, a lot of that will not give us the optimum life that we can have. So our mental health really does impact every aspect of our life, from our relationships to our families, with ourselves, what we do in work, and as we get older, also how we deal with our journey in our older age. So we do have a seminar which we call the Road Less Traveled, Navigating the Complex Terrain of Elderly Mental Well-Being. I think it is encouraging to know how much emphasis we are putting on that now in our country and in our mental health services. I really like this little icon. If you can see it, it says, either I will find a way or I'll make one. And sometimes that's an important philosophy as we navigate our life, I think particularly as we get older. So we know that mental health matters. That's the key that we're looking at. This was a nice slide that I found in regards to when our elders face mental health conditions. And as you take a look at this, you can see that some of the common conditions, delirium, depression, anxiety, a true diagnosis of schizophrenia, or relocation stress syndrome, we need to know that although not happy we have them, it is pretty common for many of us in America. And it's okay, just like it's okay to have diabetes or arthritis, having a mental health condition is okay. And we're now kind of taking it out of the closet and looking at what we can do to help people on that road. So on the left-hand side, these are just some tips of what to look out for, either for yourself or for the elder you might be taking care of. Now you can see if they have self-harming behaviors, maybe they have a sudden change in their mood where they're more depressed or more anxious. They might not be eating like they used to, or they've started to really withdraw from you. Other things could be that they just have an overwhelming feeling of free-floating anxiety, guilt, worry, or they're just very restless at night. So the good news is there's also pragmatic ways to help somebody in their mental wellness journey. Just talking to people, just having a heart-to-heart and listening to them, active listening. We know it's critical to know that communication, 75% of it should be us listening to the elder, and 25% of giving them feedback and assisting, and just having time. My mother used to always say, I gave your grandmother my time. And I really remember that's such a good lesson to make sure that we are giving them time. The daily routine, socializing with others, and planning ahead for the future. You know, that's the hope that we have, is knowing that no matter what age we are, we have something to offer, something to give. And the more that we can show that we have a future, because none of us know how long we're going to live, right? And so I think it's important, no matter what age we are, to think about the hope we have, the gifts we have that is here for today and tomorrow. And of course, to make sure we are getting the right medical therapies to help us along. So that's just a couple of tips on thinking about mental health journey, how it impacts all of us, and ways that we can help both ourselves and our family members. So see you next time.